Welcome to today's Healthcare and Tech Deep Dive.
Yeah.
We're going to be hitting those top stories from the usual suspects,
Right.
Becker's Roman Healthcare,
Yeah.
but we're also going to be pulling from the Atlantic, Kevin MD, to get a sense of,
Yeah.
the bigger picture, right?
Yeah.
And we're seeing some pretty fascinating themes emerge.
Yeah.
I mean, a lot of M&A activity and private equity.
Oh, yeah.
Just a ton going on there. AI advancements that are really kind of like raising eyebrows.
Yeah.
And then, of course, usual, ongoing challenges facing U.S. healthcare. So we got a lot to unpack today.
A lot going on.
Let's just jump right in.
Let's do it.
So first up, this Walgreens thing. I mean, are they going private or not?
Right.
CNBC is saying the deal's mostly dead.
Yeah.
But with Sycamore Partners, I mean, if it happens, that would be a massive shift.
Huge.
I mean, what do you think?
Well, I think it really shows just how interested private equity is getting in healthcare.
Right.
Like, this is a big one. And if it does happen,
Yeah.
I think we're going to have to just wait and see how it affects Walgreens, what they do about patient access and affordability.
For sure, for sure. And then you got Ohio Health. They're still expanding. They just finalized their 16th hospital acquisition, bringing Morrow County Hospital into their network.
Yeah.
So, I mean, is this good or bad for healthcare?
I think it's a little bit of both.
Yeah.
I mean, consolidation, it can be good for efficiency,
Makes sense.
sharing resources, but
Yeah.
you also got to worry about monopolies, reduced competition. What's that going to do to prices?
Great you.
Efficient choice.
Yeah, that's always the concern. Okay, let's talk AI DeepSeek, this Chinese startup.
Right.
I mean, they're making some serious waves with their open source AI model.
Oh, yeah. They're shaking things up for sure.
DeepSeek R1.
Right.
And Nvidia even praised them,
I know.
which is crazy because DeepSeek's emergence actually caused their stock price to drop.
Yeah. That's pretty wild.
But what makes DeepSeek so different?
Well, I think the big thing is open source, right?
Okay.
OpenAI, they're really influential, but they've gotten kind of secretive. Yeah. DeepSeek, they're putting it all out there. Anyone can use it, modify it. I mean, that could really speed up AI development.
That's true.
But then there's the question of, control potential for misuse. It's kind of a bold move.
Right. Yeah. And, you've got publications like Raman Healthcare sounding the alarm, calling it a security nightmare.
Right.
Saying data's being sent back to China. Others are saying that's just fear-mongering.
Yeah. It's a bit of a geopolitical thriller unfolding, isn't it?
It really is. Yeah, it's kind of hard to know what to believe.
Well, I think we need to investigate those concerns, for sure.
Of course.
But we also need to be careful about, jumping to conclusions. We need evidence, transparency, accountability.
Absolutely. Okay, let's bring it back to healthcare. A new voice-based AI tool
Oh, yeah, I saw this.
for early Alzheimer's detection.
I mean, that's something.
Diagnose Alzheimer's just by analyzing someone's voice.
It could be huge.
Early intervention.
Absolutely. Early intervention is key.
Totally. And it could pick up on those subtle changes in speech that we as humans might miss.
Right. And that could make a huge difference.
Totally. UNC Health, they're implementing this thing called...
Intelligent optimization and automation.
Yeah, basically to streamline workflows across their entire system.
It's amazing how AI is finding its way into every corner of healthcare.
Yeah, it's like everywhere you look.
Right.
Advent Health Surgery Center in Florida, they're now using a surgical robot for total knee replacements.
I saw that.
And they're saying it's been a seamless transition.
That's great.
Really successful.
It's really remarkable how far robotic surgery has come.
Oh, yeah?
I mean, less invasive procedures, faster recovery times.
Right.
Potentially even better outcomes for patients.
Yeah, pretty amazing stuff. Speaking of surgery, we've got some news in the ambulatory surgery center market.
Uh-huh.
Already, Autism Health just acquired Commonwealth ABA.
Oh, wow.
And they secured a pretty hefty private equity investment.
That's interesting.
Yeah. So it seems like behavioral health, in particular autism therapy, is really on the rise.
Makes sense. The rising prevalence of autism and just more awareness about early intervention.
Yeah, for sure. And, private equity seems to be everywhere in healthcare these days.
It really does.
But let's shift gears a little bit and talk about some of the challenges facing U.S. healthcare.
Okay.
The Healthcare blog published a piece that really highlighted this neglect of maternal mental health.
Yeah, that's a serious issue.
I mean, it's a sobering reminder that we still have a lot of work to do.
We do. And I think the article made a really important point about systemic failures. We need to look at the root causes of this neglect.
Absolutely. And on top of that, we're seeing reports about hospital capacity concerns, drug shortages,
Right.
9 new shortages on the list.
Yeah.
And then there's the whole debate about the 340B drug pricing program.
Yeah. Those are all really complex issues.
They are.
Hospital capacity, it's a recurring problem, especially with seasonal fluctuations and staffing shortages.
Yeah.
Drug shortages can happen for a lot of reasons: manufacturing problems, supply chain disruptions, and pricing pressures.
Right.
And the 340B program, it was supposed to help safety net providers,
Right.
but there's this argument that it actually incentivizes hospitals to use more expensive drugs, and the savings don't always go to the patients.
Right. Right. And then you've got pharmacists speaking out about the Medicare drug price negotiation program.
Oh, yeah, I heard about this.
They're saying it could actually force them to stop carrying certain drugs because they could lose money.
That's not good.
Yeah, it seems like there are some unintended consequences here.
Definitely. It's a reminder that these policies can have really far-reaching effects.
Totally. Rawan Healthcare published a really interesting article about CEOs and AI.
Okay.
They were asking how immersed CEOs should really be in day-to-day AI operations.
That's a great question.
It is, right? Should they be like in the weeds, or should they just focus on the big picture strategy?
It probably depends, on the CEO's background,
Right.
the company's culture, the specific AI initiatives that are in play.
Yeah, for sure. It's definitely something to think about. On a more positive note, we're seeing this trend of the feminization of medicine.
Oh, yeah, I read about that.
Women have outnumbered men in medical schools for 6 years in a row now.
It's a big shift.
It is.
But interesting to see how it affects healthcare culture, leadership, patient care.
For sure. For sure. And before we move on, I just wanted to mention heart disease and stroke.
Still the leading causes of death.
Still the leading causes of death in the U.S., according to a new report from the American Heart Association.
It's a reminder that we still have a lot of work to do on the prevention front.
Absolutely.
Lifestyle choices addressing health disparities. We need to do more.
Absolutely.
Yeah, and we got to make sure that care reaches everyone, right? Those who are most affected.
Absolutely. And speaking of disparities, there's this article in KFF Health News about how schools are struggling to keep up with, children's diabetes technology.
Oh, wow.
Parents are basically having to monitor blood sugar levels remotely because the schools aren't equipped to handle things like continuous glucose monitors.
Yeah, it's like we make these incredible advancements,
Right.
but the support systems aren't always there.
Totally. Okay, let's talk politics. President Trump is back in the headlines with this freeze on federal
I
grants.
saw that.
Healthcare Dive is reporting this could have a huge impact on healthcare providers who depend on that federal funding.
Especially for programs like Medicaid.
Exactly. It's
Yeah.
like, how are they supposed to plan for the future with all this uncertainty?
Yeah. It's a big concern.
It is. And then you've got the ever-present threat of cybersecurity.
Oh, yeah.
Baptist Hospital in Texas, they just suffered a cyber attack.
I heard about that.
Disrupted their whole network, forced them to scramble to restore operations. I mean,
It's a constant battle, isn't it?
it really is. And the Change Healthcare cyber attack.
Oh, my God.
The number of people affected has almost doubled
No,
to 190 million.
that's just unbelievable.
I know, it's mind-boggling. Okay, let's shift to something positive.
Okay, good.
Duke Health and UNC Health, they're teaming up to build North Carolina's first standalone children's hospital.
Oh, wow, that's fantastic.
Isn't it? I mean, this is huge for families who need specialized pediatric care.
It's a great example of collaboration.
Totally. And speaking of collaboration, Premier Inc., they just released their advocacy roadmap for the 119th Congress.
Oh, yeah, what are they pushing for?
So they're really focused on policies that empower healthcare providers to drive innovation,
Okay,
really lead the transformation of the industry.
I like that.
Yeah, it's a proactive approach.
It is.
Okay, Vizient. They're predicting a 2.3% rise in spending on medical devices and supplies.
Interesting.
Yeah, they're citing increased demand and, the ongoing supply chain challenges.
Yeah, those don't seem to be going away anytime soon.
Not really.
Yeah.
And Ascension, this large Catholic health system, they're making some big moves to improve maternal health outcomes.
Good. I mean, we really need to address the maternal mortality rate in the U.S.
We do. It's a crisis.
Mm-hmm.
And speaking of big numbers, Cleveland Clinic, they just reported serving the largest number of patients in their history.
Wow, how many are we talking?
Over 15 million patient encounters worldwide.
That's incredible.
It is impressive, right?
Yeah.
Their commitment to access is pretty amazing.
Yeah, it really is.
We can't forget about physician well-being.
Right, of course.
The Journal of Healthcare Contracting had a piece about the challenges physicians are facing, burnout stress.
Yeah, it's an ongoing issue.
It is, and it takes a toll on everyone. It's good to see some companies stepping up to address climate change.
Oh, yeah, like who?
J-Yojo Industries, the makers of Purell.
Okay.
They just had their climate targets validated by the Science-Based Targets Initiative.
That's great to hear.
Yeah, it's good to see some leadership on that front. And KFF just published this overview of President Trump's executive actions on global health.
Interesting.
Really tracking their impact on U.S. global health efforts.
Makes sense. I mean, those actions have pretty far-reaching consequences.
They do. Okay, get ready for this one. Thermo Fisher Scientific just introduced a new tool called Olink Reveal.
Okay.
And it's setting a new standard for affordable high-plex proteomics.
Wow, so researchers can identify those protein biomarkers more efficiently.
Exactly.
Yeah.
Which could lead to breakthroughs in disease diagnosis and treatment.
Right. That's exciting.
It is. And then we have this Canadian company, Treatment.com AI. They're acquiring a UAE-based tech company called Alea Health.
Interesting.
Yeah, it's really cool to see this global collaboration happening in healthcare tech.
It's a global world now.
It really is. Speaking of global, the Ontario government in Canada, they just announced this massive $1.24 billion investment.
Wow, what for?
To connect residents to primary care teams by 2029.
That's a huge investment in primary care.
It is. They're really trying to improve access, make sure everyone has a medical home.
That's great.
Yeah, and there's this new study out of the UK suggesting that GP continuity of care could really reduce workload.
Okay.
And lead to better outcomes.
I mean, it makes sense, right? Building that relationship with your doctor.
Exactly. They found that 1 in 10 appointments could be avoided if patients consistently saw the same GP.
Wow, that's significant.
It is. And nice that the UK's National Institute for Health and Care Excellence, they just released these new guidelines advising GPs to ask patients about gambling.
During checkups.
Yeah, during health checks and appointments.
Interesting.
Yeah, it's a proactive approach to, addressing gambling addiction.
It is good for them.
Yeah. So a study published in Raman Healthcare looked at COVID-19 influenza and RSV during the last 2 respiratory illness seasons.
Okay.
They found that while COVID-19 was still associated with worse outcomes than the flu or RSV,
Okay.
those differences were less pronounced in the most recent season.
So it seems like things might be leveling out a bit.
Maybe. But we need to keep monitoring it.
Absolutely.
Lawson Research Institute in Ontario, they just got funding to improve the treatment of workplace injuries.
Oh, that's important.
Yeah, it's a big issue, and it affects so many people.
It does.
Dan et al. Emirates Hospital for Women and Children in the UAE, they're partnering with ProFam, a UK-based company, to provide reproductive health services. Yeah, so it's really expanding access to specialized care for women in that region.
That's great.
And there's another big acquisition happening, Pure Health. A healthcare company in the Middle East, they're buying a 60% stake in Hellenic Healthcare Group.
Wow, and they're a major provider in Greece, right?
They are. It's a $2.3 billion deal.
Huge.
Yeah, Pure Health is really expanding their reach in Europe.
It's interesting to see these global healthcare companies emerging.
It is. And KBR, a U.S.-based engineering firm, they just got a contract to provide medical support services for the U.S. mission in Iraq.
Wow.
Yeah, it highlights how healthcare delivery isn't just about hospitals and doctors.
Right, it takes a whole network.
It does. In Malaysia, Alpro Pharmacy is teaming up with Oimiron Healthcare to improve blood pressure management.
Using technology.
Yeah, they're really empowering patients to take control of their health.
That's great, especially for chronic conditions like hypertension.
Absolutely. Okay, this is cool. UC Davis Health in Sacramento, they just became the first customer to order the EndoDrill GI.
Okay, what is that?
It's this new device from a Swedish company called BIB Instruments for gastrointestinal cancer care.
Wow.
Yeah, it's designed to improve accuracy and effectiveness of treatments.
That's a game changer.
Could be. And then we have Doctors, a Japanese digital healthcare company. They're planning to enter the U.S. market this year.
Interesting.
Yeah, bringing their innovations to the U.S. healthcare system.
Competition is always good, right? Drives innovation.
Absolutely. Kevin M.D. published this thought-provoking piece called The Lie Destroying Medical Careers: How Lack of Business Education is Ruining Physicians.
Okay, that's a strong title.
It is, right?
Mm-hmm.
The author is basically arguing that doctors aren't prepared for the business side of healthcare.
Like contracts and negotiations.
Right? Exactly. They say medical schools need to do a better job of teaching those skills.
Yeah, I can see that.
Right, because not all doctors are going to be pure clinicians.
Right. Some will be running their own practices.
Exactly. Raman Healthcare had an article about health systems reevaluating their cloud strategies.
Oh, interesting. Why?
Concerns about cost overruns and, reduced control.
Yeah, I mean, the cloud's not a perfect solution.
It's not, and you always have to weigh the risks and benefits.
For sure.
Good news, UW Medicine just achieved HIMSS Stage 6.
Oh, wow. Congratulations to them.
Yeah, health system CIO highlighted their focus on AI-powered decision support, strong governance, clinician collaboration.
They're really doing things right.
They are. Cotiviti, a healthcare analytics company, they're advocating for a multifaceted approach to fighting fraud, waste, and abuse.
Okay.
Yeah, going beyond the traditional methods.
So, like, what are they suggesting?
Advanced analytics, predictive modeling, proactive interventions.
That's smart, using data to get ahead of the
Oh,
problem.
exactly. And some good news on the financial front.
Okay.
Gibbons Advisors just reported that healthcare bankruptcies actually declined in 2024.
Really? That's surprising.
It is, they're citing government support during the pandemic, improved financial performance, and a decrease in mergers and acquisitions.
Okay, so maybe things are stabilizing a bit?
Maybe,
Yeah.
but it's still a fragile industry.
For sure.
Okay, this is a bit concerning. A new KFF tracking poll found that public trust in health information from government agencies like the CDC and FDA has declined.
Oh, wow. That's not good.
It's not, they're saying it's partly due to misinformation about vaccines.
Especially among Republicans and parents.
Yeah, and it's fueling this skepticism.
We need to rebuild trust in our public health institutions.
Absolutely. And the same poll found that the public is divided on how prepared the government is for future health crises.
After the pandemic, I can understand why.
Right. It's like we need to learn from our mistakes and make sure we're better prepared next time.
For sure.
The IE Journal of Biomedical and Health Informatics, they published a study about this new multitask learning framework called Dementia.
Okay.
And it's designed to improve early detection of Alzheimer's using voice recordings.
Oh, wow. That's amazing.
It is.
Right?
I mean, imagine being able to pick up on those subtle changes in speech.
And intervene early.
Exactly. Kevin MD had a great article about the importance of those little things in patient care. You know, the front desk staff, accessibility, accurate billing practices.
Those things make a big difference.
They do. They shape the whole patient experience.
For sure.
And another Kevin MD article offered these 4 hacks to improve patient experience.
Okay, but listening.
Focus on the first impression communication streamline processes and really put the patient's needs first.
It sounds simple, but it's so important.
It is. And Experian, they were talking about optimizing revenue cycle management.
To improve the patient financial experience.
Yeah, and protect hospital profits.
Right, because that's important too.
It is okay. This KFF analysis found that healthcare.gov insurers denied almost 20% of in-network claims in 2023.
Really?
Yeah, it's raising concerns about access and affordability.
Even if you have insurance.
Exactly. And another KFF analysis looked at claim denials and appeals.
Okay.
They found that very few people actually appeal those denials.
Even though they might be successful.
Right, so there's a lack of awareness there. KFF is actually hosting a virtual event on February 10th called the Health Wonk Shop, What's Next for the Affordable Care Act.
Oh, that sounds interesting.
Yeah, they're going to be talking about the future of the ACA, those expiring subsidies.
It's a timely topic.
It is for sure. Medigence shared this incredible story about a stroke patient from Mozambique.
Oh, okay.
He's 67 years old, and he regained his ability to speak after undergoing rehab at a hospital in India.
Oh, wow. That's amazing.
It's a testament to the power of rehabilitation.
Absolutely.
And the First Minister of Scotland just announced a £10.5 million investment to boost capacity in GP practices.
Good. They're under a lot of pressure.
They are, and this will hopefully help them address that rising demand.
Hopefully.
Highstock just reported that Raintree Systems acquired Yumi Health, a company specializing in AI for rehab therapy.
Oh, cool.
Yeah, so they're integrating that AI technology into their platform.
Makes sense. AI is everywhere.
It really is.
Yeah.
Healthcare Dive had a piece about how leading healthcare providers are combining multiple types of AI.
Oh, interesting. Like what the...
You know, machine learning, natural language processing, computer vision.
It's like AI on steroids.
It really is, and it's transforming patient care.
It is exciting times.
It is. The Atlantic highlighted a less brutal alternative to IVF.
Oh, okay. Tell me more.
It's called in vitro maturation, or IVM.
Okay.
So instead of stimulating the ovaries to produce mature eggs, they collect immature eggs and mature them in the lab.
That sounds less invasive.
It is, and potentially more affordable.
That's a game changer for a lot of people.
Totally. Abbott just announced their fourth quarter and full year results for 2024.
Yeah.
They're predicting continued growth.
Good for them.
Yeah, positive signs for the healthcare market.
For sure.
The Atlantic had this really interesting piece about the potential dangers of AI.
Okay, like what?
They were talking about this new platform called Character.ai, where you can interact with these imaginary avatars.
Based on real people.
Yeah, even deceased people.
Wow, that's kind of creepy.
It is, right? It raises all these ethical questions about, the blurring of reality and simulation. HealthPopulate.com asked this question: can the private sector fill in for the public sector when it comes to health information gaps?
That's a good question.
It is right,
Yeah,
because the public sector plays such a crucial role.
for sure.
And Kevin MD had a scathing critique of health insurers.
Oh, what do they say?
They basically called them out for their profit-seeking practices.
Yeah, I mean, there's definitely a tension there between profits and patient well-being.
Absolutely. And healthaccess.org, they were talking about the potential impact of federal budget cuts on California's safety net.
Like Medi-Cal and Covered California?
Exactly. Those cuts could really hurt vulnerable population.
They could.
BOTCU highlighted a new study about copper-infused surfaces,
Okay.
and they're finding that it's really effective at killing C. diff spores.
Oh, wow, that could be huge for preventing infections.
It could be a game changer.
Especially in hospitals.
Totally. And this is just a reminder to always wash your produce, because Healthcare Asia Daily News just reported that 3.7% of orange shipments tested recently had excessive pesticide levels. I know, right? ReviewFitHealth.com had a couple of interesting articles.
Okay.
One was about the benefits of collagen.
For skin, bones, joints.
Exactly. And the other one offered tips to avoid weight gain during the winter.
Oh, that's always a challenge.
It is. iClinic blogs discuss the benefits of anger management therapy.
For controlling those outbursts.
Yeah. Learning how to recognize triggers and respond in healthier ways.
That's important for overall well-being.
It is. In Montana, they're considering a $30 million revamp of their mental health and developmental disability facilities.
Oh, wow. That's a big investment.
It is. It shows a commitment to addressing the needs of that population.
It is good for them.
And the KFF Health News podcast, The Health Wonk Shop, they just released an episode about the Shkreli Awards.
The what?
Yeah, they're given out annually by the Loan Institute to highlight those outrageous stories of greed in healthcare.
Oh, yeah, I've heard of those.
Yeah, it's pretty eye-opening.
It is.
HealthViewX.com had an article about reducing burnout in healthcare providers.
Yeah, it's a huge problem.
We need to create more supportive work environments.
Absolutely.
Highstock did a curbside consult with a physician informaticist, Dr. Jane.
Okay.
She was talking about the importance of social care data for improving community health.
Like housing and food security.
Exactly, the social determinants of health.
Right.
And they also stress the importance of strong governance for IT projects.
Keep things on track.
Exactly. Healthcare Economist had a piece about the Medicare drug price negotiation program and its potential impact on innovation.
Oh, yeah, that's a hot topic.
It is. Will it stifle innovation or make drugs more affordable?
We'll have to see.
We will. And KFF Health News reported that schools are still not equipped to handle children's diabetes technology.
Yeah, that's a problem.
It is parents are having to pick up the slack.
We need to support those families.
We do. And they also published an article about RFK Jr.'s nomination hearings this week.
Oh, yeah, he's up for HHS, right?
He is. And it's going to be interesting to see how his views on vaccines play out. And a reminder that extreme weather can really disrupt healthcare services.
Oh, yeah, like what happened?
Storm Elwyn just hit the UK.
Okay.
Damaged some practices, disrupted GP services.
We need to be prepared for those kinds of events.
Absolutely. Remani on Healthcare had a couple of AI-focused articles.
Okay.
One was about the rise of AI agents in enterprise automation.
They're changing the way we work.
They are. And the other one was about how executives need to think more strategically about AI.
Not just focus on the short-term gains.
Exactly. Redeemer Health, a community health system in Pennsylvania, they're considering selling assets.
Oh, wow. Why?
They're trying to meet turnaround targets after breaching a debt service covenant requirement.
It's a tough situation for them.
It is, and it highlights the financial pressures facing a lot of healthcare organizations.
Sure.
And pharmacists are raising concerns about the Medicare drug price negotiation program.
What are they worried about?
They're saying that stocking those negotiated drugs could actually hurt their businesses.
Because of lower reimbursements?
Exactly. Okay, Raman Healthcare had a bunch of articles about this Chinese AI startup, DeepSeek.
Oh, yeah, they're making a lot of noise.
They are. One article was about the concern they're causing in Silicon Valley and Wall Street.
I mean, they're a potential threat to U.S. dominance in AI.
Right, and another one was about whether they're sending data back to China.
That's a big concern.
It is. And then they had another piece about DeepSeek's R1 AI model.
They're game changer.
And we talked about the potential benefits and risks for businesses.
It's a double-edged sword.
It is. Health Tech Magazine had an article about Retrieval Augmented Generation, or RAIGE.
What is that?
It's basically a way to combine large language models with external knowledge sources.
Okay.
So it's making healthcare AI even more powerful.
Interesting.
And then Rama Healthcare had a piece about the dual nature of AI and cybersecurity.
Right. It can be used for good or for evil.
Exactly. And finally, a KFF analysis found that health insurers denied a lot of in-network claims in 2023.
Like we were talking about earlier.
Right. But the problem is there's not a lot of transparency about why those claims were denied.
Yeah, that's a problem.
It is. We need more accountability.
For sure. Yeah, it makes it really hard for patients to understand what's going on.
Right. And it erodes trust in the system.
Exactly.
Well, we've covered a lot today.
We have.
Mergers and acquisitions, AI advancements, challenges in U.S. healthcare. It's been a whirlwind.
A lot to process.
It is. So what does this all mean for our listeners?
Well, I think we're seeing a healthcare system in transition.
Right.
Technology's changing everything. Private equity's playing a bigger role. And we're still grappling with these fundamental questions about access, affordability, and the future of care.
Yeah, it's a lot to think about.
It is.
But the good news is you're now armed with the knowledge to understand these developments.
Right. Knowledge is power.
Exactly.
Yeah.
So as we move forward, the question is, will all of these trends lead to a better healthcare system?
A more equitable system.
Right. One that's accessible, innovative.
Yeah, that's the challenge and the opportunity before us.
And the answer, I think, lies in all of us staying informed, engaged, advocating for what we believe in.
Absolutely.
So thank you for joining us on this deep dive into healthcare and tech news. We'll be back tomorrow with more headlines and insights.
See you then.
Until then, stay curious and stay engaged.